So this is a loading technique to the front part of the leg or the shin area, more on the outer part of the shin, right in through here. So from the knee to right about the ankle. So now you're going to need to use a ball or a foam roller or something equivalent. There's 3 different positions that you can do this in. You can do it in a prayer position like this. You can do it in a half kneeling position like this. Or you can do this lying face down. So what I'm going to do is I'm going to demonstrate this half kneeling. So what I'm going to do is use a foam roller. I'm going to place it on the floor. I'm going to place my shin on top of that foam roller. So I'm actually going to start a little bit more towards my knee, and then I'm going to shift this direction so that the roller goes down towards my ankle. And then what I'm going to do is I'm going to find an area of increased sensitivity. Now I can place both my hands on the floor so I have 3 points of contact, actually 4 if you include this. So both my hands, this opposite foot is going to bear most of the weight while my shin is getting worked on. So I'm just going to find the spot, boom, right there. Once I feel the increase of sensitivity, what I can do is number one of 2 things. I can do the seek and destroy, so I'm finding the area, holding that, and just applying pressure. So I can apply more pressure by going into a tall kneeling position, or I can add more pressure by just leaning into that tissue a little bit more. And once I feel that sensitivity kind of dissipate, then I can go and seek another position and do the exact same method. If I want to try the other option, which is called the pin and stretch, I can find the target tissue or the sensitive area, hold that position, and then move my ankle as a driver. So I'm moving it in different positions, trying to feel an increase of the load in that tissue until it kind of relaxes. The other way that I can do that is I can keep my foot stationary and then sit up a little bit taller. When I sit up taller, what's actually happening is the tissue is actually moving this direction versus going that direction when you're moving your ankle. Where you can just kind of pin that tissue down, and then now you're going to stretch it by being nice and tall. So my knee is down, making it a tad bit easier for me to accomplish this task. So I'm going to show you the other positions. The prayer position is you're going to place both your shins on top of the roller, and then you can go back and forth just like that, where my hands are planted on the floor and my shins are rolling up and down. That's the first one. The second one is you're going to be lying face down. So I'm going to place a roller right in through there, and then I'm going to lower my body, making sure that my shins are on the roller. This is more of a elbow or forearm plank. I'm going to raise my pelvis off of the floor, and then I'm just going to roll down and up, trying to find that target tissue again. That area of sensitivity. Hold that there and choose whatever technique you want to use, whether it's the pin and stretch or the seek and destroy.